My name is Brandon Howard, and today I'm going to inform you about one of the most interesting aspects of medicine, surgery. From surgery itself to the reasons we have them, surgery remains one of the most unique aspects of medicine. Did you know that Americans will undergo an average of 9.2 surgeries per lifetime, according to the American College of Surgeons Massachusetts chapter? Many people will, if they have not already, have surgery. When you want to know what is going on and what is going to happen and the reason for it, I've always had an aptitude for medicine and surgery, and I've always loved it. The surgical aspects of medicine have always fascinated me. I've read and studied many different things about medicine and the surgical aspects of it. First, I will discuss surgery. Second, I will discuss the advancements of surgery. Finally, I will discuss the reasons for having surgery. Surgery has been used since approximately 6500 BCE. This to me is very fascinating. According to R. Porter, 1997, in his article, The Greatest Benefit to Mankind, which is pictured here, the first type of surgery was called trephining, which was cutting a small round hole in the head. This is one of the most feared aspects of medicine and was usually the last resort for the doctor and the patient. The first use of ether as an anesthetic, according to Jennifer Whitlock in her article titled A History of Surgery, was in 1843. Surgery back then was not as we know it today. It was not as common as today either. According to Whitlock, one of the most common surgeries today, the appendectomy, was not used until 1885. If someone before 1885 got appendicitis, the patient usually died after the appendix ruptured and the infection was released to the body. Surgery was never used in the early days unless it was a last resort or out of ignorance. According to Whitlock's article, she states that the early surgeons were very crude and were normally performed out of desperation or ignorance. This goes back to the earliest known form of surgery, trepanation, which is pictured here. This is a skull found after having the trepanation surgery, and that is the device that was used to drill the hole in the head. As I mentioned earlier, trephining or trepanation is the procedure of making a hole in the skull. This is the rudimentary form of what we know today as burr holes. Human remains have shown that this procedure had a fair success rate given that it was used in 6500 BCE. Now that I've discussed the surgery and some of its history, I will discuss the advancements of surgery. Surgery has come a very long way from when the first surgery was completed to today. Today, surgery is very common and the outcomes are very good. According to Stanford Healthcare, in 2009, 48 million surgical inpatient procedures were performed in the United States alone. Surgery now has become far more advanced than anyone could have imagined in the 1800s. With the new technological advancements, surgery can be performed at any time of the day with the proper tools. There are many different types, such as open and laparoscopic surgery. Now it is common for someone who needs a heart valve transplant to receive one in many ways. According to the American Heart Association, there are more than 5 different surgical options for heart valve replacement. There are mechanical valves, tissue valves, which can include human cadaver, bovine cow, or porcine pig tissue, the Ross procedure, the TAVI or TAVR procedure, and newer surgical procedures. The Ross procedure uses your existing healthy valve and taking part of it and moving it to the position of the damaged valve. The TAVI or TAVR procedure is a transcatheter aortic valve replacement. It is one of the advanced procedures for aortic valve replacement. Along with new types of surgeries, robots can assist in surgeries now. There's a special robotic device that assists surgeons in different types of surgeries. This robot is called the Da Vinci Surgery System. According to DaVinciSurgery.com, the robot assists the surgeons to be able to operate with enhanced vision, precision, and control. Now that I've discussed the advancements of surgery, I will explain some of the reasons we have surgery. There are many reasons people have surgery. People have surgery to save their lives. As I mentioned earlier, appendicitis, if left untreated, can lead to fatal complications. The appendectomy is one of the most common surgeries performed by surgeons today. Some surgeries are far more complicated. These surgeries can include tumor removals. Tumor surgeries have become far more advanced. According to Texas Oncology, brain tumors can be treated with tumor removal surgery, which is the most common treatment for these types of tumors. If someone before the surgical advancements had a brain tumor, this condition would almost always be fatal or have devastating effects on the person. Some people have to have surgery to correct botched surgeries. Many people go out of the states to have plastic surgery to correct features on their bodies. This oftentimes results in a botched surgery. Once someone has a botched surgery, they will either wait and see if it will get better, or they will try to find a respected and reputable surgeon to correct the other surgeon's mistake. One TV show shows this. The title of that show is Botched. It features doctors Terry Dubrow and Paul Nassif. Many of their patients have gone to a foreign country to have a surgery at a lower cost, or because the surgeon in the United States would not perform it for them. They take in a variety of patients, sometimes ones that ask too much of the doctors and they have to turn them away. Some people have plastic surgery to correct a body part. Plastic surgery isn't always used because the person doesn't like the way they look. Many people have corrective plastic surgery due to a deformity or abnormality that causes problems in their lives. An example of this is when someone goes under the knife for a procedure called a rhinoplasty. According to the American Society of Plastic Surgeons, a rhinoplasty is used to correct a deviated septum. When the septum is deviated, it can be hard for the patient to be able to breathe. Today I first discussed surgery themselves. Second, I discussed the advancements of surgery. Finally, I discussed the reasons for having surgery. From surgery itself to the reasons we have them, surgery remains one of the most unique aspects of medicine. In conclusion, surgery has and always will be one of the most interesting aspects of medicine. It is always changing, and this is shown from the first surgery to today's most advanced surgeries. Thank you for listening.